Hi everyone, my name is Sandy Nguyen and I will be doing my presentation on tetanus or lockjaw. So the infectious agent for tetanus is a bacterium named Clostridium tetani. The bacteria itself is rod-shaped, gram-positive, and motile with its various flagellas that surround the body. The bacterium is also spore-forming and will resemble a drumstick shape. And these spores are extremely resistant to heat and other antiseptics and can survive for years. And these spores are also benign, but they're ubiquitous, meaning they are found literally everywhere on this earth, including soil, ash, dust, manure, and can remain in the intestinal tracts of animals as well as their feces. The disease starts with the introduction of tetanus spores into the body via a percutaneous wound. And once in the wound, there's limited exposure to air and thus a lower oxygen environment, which is perfect because this bacteria is an obligate anaerobe. So now the spore will germinate and grow, and the bacterium will then release its toxins, including tetanospasmin and tetanolysin, which I will talk about later in the slides. So tetanus is practically 100% fatal with no treatment. However, since vaccinations, incidence decreased more than 95% in the US, while deaths in the US due to tetanus decreased more than 99%. And while tetanus affects the entire world and the spores are found everywhere on the world, we can see that Southeast Asia and Sub-Saharan Africa accounts for 82% of all tetanus cases globally and 77% of all deaths due to tetanus globally. And this is mostly due to the limited access of vaccines and treatment options. So now I want to talk about the history of tetanus, starting from approximately 1500 BC with ancient Egyptians' documentation of tetanus-like symptoms. And then in 4th century BC, Hippocrates wrote about tetanus being associated with wounds, or tetanus symptoms being associated with wounds. In 1884, we get the first clear connection between tetanus and soil when Arthur Nicollier injected animals with soil samples, and then they developed those characteristic signs of tetanus. Then in 1889, Kitasatu showed that the bacterium could produce the disease when injected into animals and that the toxin could be neutralized by specific antibodies. Then in 1924, we get the first tetanus toxoid vaccine. And thus, after this, especially during World War II, this toxoid vaccine was widely used and administered, especially for soldiers that had to endure battle wounds. So now going back to the toxins that I talked about. So tetanus toxin is an extremely potent neurotoxin produced by the vegetative cell of Clostridium tetani. The toxin tetanospasmin spreads through the tissue spaces into the lymphatic and vascular system. And this toxin has specific binding to the periphery neurons, and it will enter the neuromuscular junction and migrate through the nerve trunks into the central nervous system by retrograde axonal transport using dyneins, which are just cytoskeletal motor proteins. And while not much is really known about tetanolysin, we know that it causes the destruction of tissues and red blood cells. So now going into the symptoms. So it takes about 10 days between infection and the onset of those characteristic manifestation of tetanus. And the total incubation period could be as short as 3 days, or it could be as long as 21 days. And the symptoms of tetanus begin usually gradually and progressively gets worse over the next couple of weeks. Some of the characteristic symptoms of tetanus include locked jaw, or that inability to move your jaw, stiff abdominal and back muscles, muscle spasms of the facial muscles, tachycardia, which is just fast heart rate, fever, painful muscle spasms, difficulty breathing and swallowing because of the stiffness of the neck and the facial muscles, and then hyperhidrosis, which is just excessive sweating. So now I want to go into the main types of tetanus. There are 4. There's generalized tetanus, localized tetanus, neonatal tetanus, and cerebral tetanus. So first, talking about generalized tetanus, this is the most common type, accounting for about 80% of all tetanus cases, and it usually progresses in a specific pattern, following first the locked jaw, then the stiffness of the neck, then difficulty swallowing, and then the rigidity of the abdomen and back. And this can last up to 4 weeks, but full recovery can take up to several months. And then we also get some autonomic instability, including fever, dysrhythmia, labile blood pressure and heart rate, respiratory difficulties, and even early death. Next, localized tetanus. So localized tetanus is basically just these smaller and more persistent contractions of the muscles at the specific site of the injury, and this can persist for weeks. So if you get an injury on your hand, then only your hand muscles would be affected. If you have an injury to the head, which I'll talk about later, encephalic tetanus, then you would only get those kind of spasms in the head. And localized tetanus is uncommonly fatal, but it can progress into a generalized form of tetanus, which is much more fatal. Okay, so next going on to neonatal tetanus. So neonatal tetanus is just the generalized tetanus, but in a newborn infant. And this is because if the mother is not vaccinated, then the baby will not have that protective passive immunity against tetanus. So this will usually start with an infection of the umbilical stump during delivery when it was cut with an unsterile medical instrument. And this will result in poor feeding, increased fussiness, facial grimacing, which is just like that involuntary smile and rigidity, and then severe spasmic contractions that are triggered by touch or light or breeze. So lastly, I want to talk about cephalic tetanus. So this is just the spasms involving the muscles and the nerves of the head only, but this will only occur after some sort of head trauma like a skull fracture, a head laceration, an eye injury, dental procedures, or otitis media or ear infection and different other things. And this again will cause that neck stiffness, dysphagia, and lockjaw. So now on to prevention. So the vaccine for tetanus is very safe and it's virtually 100% effective in preventing tetanus infections and the effects of its neurotoxins, but they do recommend that you get a booster every 10 years. Now there are different types of the combinational vaccines, and it kind of just has a variation of tetanus, diphtheria, and pertussis with different levels of effectiveness. So now going on to diagnosis, treatment, and management. So there's no lab test that can confirm tetanus, and it's usually diagnosed through a physical exam, looking for those clinical symptoms of tetanus, as well as examining recent history of any injury to the skin. And they also need to determine if the patient needs the booster shot or not. Usually, if they're uncertain about it, they'll just give it to them anyways. There is a specific test called a spatula test where they would basically touch the posterior pharyngeal wall or the back of the throat with some like soft tip medical instrument, such as a spatula. And if the patient does have tetanus, then they will have that involuntary contraction of the jaw and they will bite down on the spatula. But a negative test, which would indicate that they don't have tetanus, would just be a gag reflex. So if a patient does come in and they do have tetanus, some of the things that the doctor or the physician would do is early wound debridement, so cleaning out that wound really extensively early in the infection, supportive management. So if the patient has a fever, just treating that with Tylenol, Motrin. If the patient is dehydrated, IV fluids. If the patient has tachycardia, fix that with some heart medication. Antibiotic treatment or therapy. Early intramuscular intravenous administration of human tetanus immunoglobulins. So a person who has the vaccine or has had tetanus in the past, they will use that blood and collect the antibodies in that blood and administer it to those who are suffering from tetanus in order to kind of jumpstart that immune response. Then we have neuromuscular blockade medication. So that's just, it kind of just helps relax the body a little bit since you have that involuntary contractions, and it kind of eliminates some of the pain. And they will also control various manifestations of tetanus and its complications. So some future outlooks. So complete eradication for tetanus is highly unlikely just because it's ubiquitous and the spores can remain in the environment for years and years. And there's just no good method or technique to eliminate all those spores in the entire world. But there are efforts to eliminate neonatal tetanus, and they are ongoing, and more countries are expected to reach elimination in the near future. And that's just by using sterile medical equipment during delivery, especially during the cutting of the umbilical cord. And then I also read something interesting where some studies show that the tetanus vaccine is actually effective for up to 30 years, not 10 years. So instead of having to get the booster every 10 years, there may be a possibility in a change of the schedule where people will only need to get it about 2 or 3 times in their entire life. So that's pretty cool, and it'll make things cheaper. So lastly, I want to talk about some extra facts that I learned along the way and talk about a common misconception that I think a lot of people had, especially I did. So one of the misconceptions is that there has to be the presence of rust to get tetanus infection, and there is no correlation between the two. So nails will get rusty when exposed to open air in the environment for an extended period of time. But if that nail is exposed to open air in the environment for a long time, then it also most likely has come into contact with the tetanus spores, since the tetanus spores are everywhere. And so when you step on a nail and get tetanus, it's not because of the rust on the nail, but the spores that's present on the rusty nail. Another fact is that you can get tetanus from anything at all. It doesn't need to be metal. You can get it by getting bit by a dog. You can get it from burning yourself, from having frostbite, syringe drug use, and even a really deep paper cut. All right. Thank you for listening. Bye.